I'm Dr. Manisha Geiger, founder and neuro-optometrist here at Optimum Vision and Eye Care. We are a neuro-optometric rehabilitation center here in Scottsdale, Arizona. The focus of our center is to treat all types of brain injury, ranging from traumatic brain injuries, concussions, car accidents, work-related injuries, to acquired brain injuries, such as brain tumors and strokes, as well as aneurysms. We look forward to seeing you here to help rehabilitate and get you back to your normal selves. Join me while I show you what we're all about.
Hi, Dr. Geiger here. One of the things I wanted to address today is, what is neuro-optometry? This is a question that I get asked quite a few times in the exam room by patients that have seen a number of different physicians already and are wondering what is so different about what we do. Now, neuro-optometry gets confused with neuro-ophthalmology quite often. And the big difference is ophthalmology is dealing with the structure of the eye, and neuro-ophthalmology in particular is making sure that the eye and its connection to the brain is physically sound. So here's where, if everything comes out normal with your MRI, a neuro-ophthalmologist will refer you to a neuro-optometrist, which is what we are here. And neuro-optometry deals in function rather than structure. So if you are still feeling a little off, perhaps having symptoms of double vision or blurry vision, some dizziness, lightheadedness that is unexplained, brain fog even, then neuro-optometry is the appropriate place to be. Dr. Geiger here. I wanted to talk to you a little bit about some symptoms that can occur after a brain injury. Patients don't always know how to verbalize it, but what happens is sometimes we have our eyes aren't working together anymore, and this binocular vision dysfunction will cause a number of different symptoms, including double vision, blurriness up close, balance issues, and an overall inability to multitask, or people sometimes describe it as being in a brain fog. And there's a lot of things that can happen after a neurological insult. And the main thing is the two eyes, they just don't know how to work together anymore. Sometimes we can see one eye turn in, which is an esotropia. Sometimes we see both eyes turn out, which is an exotropia. And sometimes they even are one higher than the other. So there's a lot of different things that we can look for. Binocular vision dysfunction is kind of an overall term that lets us know that somehow the two eyes are just not staying straight and aren't working together. So we need to help them play nice together. And that's what the neuro-optometric rehabilitation program here at Optimum Vision and Eye Care can help you do. Hi, I'd like to show you some of the activities and techniques we use here at Optimum Vision and Eye Care to help our neurorehabilitation patients. One of the things that happens with a neurological insult is patients tend to be easily overstimulated, and the sympathetic system's in overdrive. Everything is kind of heightened. Syntonics is one of the techniques that we use to help kind of bring that down. It's very specific to neuro-optometry. It's a type of color frequency light therapies to bring people down. And there's a variety of different colors and filters that we would be using depending on what part of the brain we want to engage. And this is called a syntonizer, where the filters go in. It's quite nice. It's very calming and helps us achieve wonderful results. Hi, I'm going to introduce you to a few of the activities that we do here at Optimum Vision and Eye Care. All of these different gadgets may look like toys, but they are engaging your brain in a variety of different ways that actually make change to your neurology. So we call it neuroplasticity. So what we're trying to do is actually brain training. It's not eye training or eye exercises, as most people might think, but all of this is hoping to make that permanent change that's going to help rehabilitate our patients. One of the things that I'm holding here, this is called a vectogram, and this is very important to get our depth perception or our stereo vision back, starting with the quoits, usually working peripheral, Again, looks simplistic, but it's actually very important to help our patients regain their balance. And over here, we've got Marsden ball, red and green letters. This is for training eye movements, such as smooth pursuits, and even sometimes use it for saccadic eye movements. Over here, we've got our Sanit Vision Integrator system, and this is a lovely touchscreen here that allows us to do some eye-hand coordination training. And this is obviously going very slow. We start slow. We can actually change the type of exercises, the pace of the exercises. There's quite a lot that we can do with these machineries. And this is just a couple of the things that we do here at Optimum Vision Eye Care.